All right, and good morning. It is July 15th. Wow, time flies.
Yes, it is.
Yep, and this is the Harlem Emergency Network COVID-19 weekly update. I'm here with Carol Johnson. I'm Bob Ponce, and we are ready to get into it. How are you doing this morning, Carol?
I am doing well.
Good to hear it. Good to hear it. So, I think our top story today we want to talk about is back to school. Uh, uh, we're looking at just weeks away from schools opening, and it looks like the country's not ready. Um, Here's a look at the New York Times coronavirus updates. Most U.S. school districts are not ready to reopen. Uh, Analysis finds. So that's not surprising. So we've got pushback all over because some of the biggest school districts in the country are at the places where the infection rate is highest, and they've been talking about a lot of the teachers are pushing back and saying, if the infection rate is higher than 5%, they don't want to go. And out of the 10 largest school districts in the country, only New York and Chicago are below that level, and that's going to be an issue. Right now, it looks really, really messy.
I'm not understanding it, and too many politicians are pushing for the states to open and send the kids back to school.
Hmm.
Um, you know, it's pretty sad when you're treating kids as statistics. If only a certain amount has it, then it's okay. Let's open up.
Hmm.
A lot of teachers, they've been doing some in-house um, preps for the teachers, and teachers are coming down with it.
Hmm.
You know,
Hmm.
so they're saying that kids are super breeders. I wouldn't even take a chance on my child going to school under these circumstances.
Hmm.
I mean, what are you going to do? What are you going to do? People don't want to send their kids going not to school,
Hmm.
regardless as to what the state says.
Hmm.
You lock people up.
It's crazy. So the teachers are saying, I don't want to go back, angry, fearful over the pressure to return. No one has answers to the critical questions. Um, on Friday, the teachers union in Los Angeles demanded full-time remote learning. And teachers around the country are saying, the same things that we're saying. Um, I want to serve the students, but it's hard to say you're going to sacrifice all the teachers, paraprofessionals, cafeteria workers, and bus drivers. So it's not just putting the kids at risk, it's putting the people who have to work in these environments at risk. Um, and even if the kids don't catch it, which is we still don't have that evidence, um, the fact is they can spread it and will spread it and can spread it literally to every family.
Right.
It just doesn't make any sense.
When I look at reports like Florida is saying they've got 11,000 kids that have tested positive for the coronavirus, that's beyond scary.
Hmm.
And the conversation is still going on about opening schools. I
Hmm.
think those stats alone should make you push back. You know,
Hmm.
when New York City began to go into its third phase, and over 2,000 reports came in to 911, 311 about people not social distancing. The streets were so crowded with people that weren't wearing masks outside the bars. Immediately the governor pushed back on in-house dining.
Hmm.
I think that same thought should go where schools are concerned, because
Hmm.
that was like within 38 hours the decision had been changed. No in-house dining.
Hmm.
That's
Hmm.
the same situation here because they're saying that cafeterias will more likely not open, gyms won't open in the schools. So, you've got a lot of these kids, if they're going to school, the only place that a lot of these kids eat are in school. But for
Mm-hmm.
right now, some of those kids have become food secure simply because they're at home, simply because they still can get those grab and go meals.
Mm-hmm.
So now, if they're at school and the meals at their house, I'm not understanding how that's going to work.
At all.
If you close all the playgrounds, everything with children will actually have a chance to do what they do, play and hug and meet and greet and, horse around.
Mm-hmm.
They're not going to be able to do that. And
Mm-hmm.
that's going to be even more difficult because these kids have been away from their friends. If
Mm-hmm.
they've seen them, it's been virtually. And now to have a class full of kids and say, no, you can't hug Johnny.
Mm-hmm.
Shirley, sit down. You can't get that close to Mary.
Mm-hmm.
That would have to be a really painful and a situation that some of their minds will not be able to grasp. But they're right
Mm-hmm.
there. Why can't I touch them?
Mm-hmm. Mm-hmm.
Why can't we play together?
Yeah. So once again, we can see that our mayor and governor can't seem to get on the same page over what's going on, and so um, Mayor De Blasio announced a plan to go back to school with um, most students going just 2 or 3 days a week, and the rest of it doing homeschooling, or rather remote schooling. And de Blasio says parents will have the option of online only instruction for their children, but he said 75% of parents want their kids in school in September. I'd like to see that survey, but of course, Cuomo comes behind it and says it's up to him to decide whether schools can open at all. Um, so I think these two really need to figure out how to be on the same page with it, because the last thing that parents need to hear right now is that the mayor is saying one thing, the governor is saying the other. We're getting different things coming from the federal government, and in like 6 weeks, the parents have to make a decision on the health and safety of their kids. It's crazy.
Well, I would say that if parents really want their kids in school, the only reason would be is because the remote learning process didn't work.
Hmm.
And you
Hmm.
still have kids who never even got tablets and never got broadband.
Hmm.
Broadband
Hmm.
and tablets. And you had teachers that didn't understand it. They couldn't access the programs. They
Hmm.
couldn't understand how to execute the programs.
Hmm.
So I mean, for a lot of kids, yeah, it did well. But for a lot of those kids that were already behind the curve, it was disastrous. So I'm
Hmm.
sure parents want their kids to catch up,
Hmm.
but I mean, not at the stake of their lives.
Hmm.
Absolutely not.
Yeah, it's crazy. It's crazy. Um, and so the other thing that's disturbing that's happening now is that evidently the federal government is now making a move. So now the data that's being collected on COVID-19 is no longer going to the CDC, but it's going to the Department of Health and Human Services. And this clearly is an effort to put the data in a place where it's politically friendly and can be manipulated. And this is really, really disturbing. Like, we're just going to make this thing go away by making the data disappear.
Yeah, you take all the power away from the experts. You stop. It's a shame when we're in the middle of a pandemic and the people who have the most information to give us on how to survive this thing are being blocked.
Hmm.
So now the president turns it over to the Department of Health. The Center for uh, Disease Control,
Right.
should always remain in charge.
Mm-hmm.
Now, Dr. Fauci can't speak to people. They're blocking everything that he's saying. And
Mm-hmm.
he's still getting out there. He's getting out there on YouTube. He's finding a lot of different venues to say, I am not going along with anything that comes from those departments. I'm telling you, this is the only way that's going to keep us safe. But if you block him from being able to get to certain media circuits so that we don't get the truth, we're like it's like a killing field. America has become a killing field.
Mm-hmm. Mm-hmm. Yeah.
Your economy, anytime someone in charge can say that you had such a great response, the best response across the world, and the European Union no longer wants to be aligned with us, countries are saying, no, we don't want you to come here. We're in bad, bad shape, America, and I don't know how much people are paying attention, but they don't want us. We've become albatross.
Mm-hmm.
So um, I still say it's going to fall back to what we've been doing, and we need to do it more valiantly now than we have been. And
Mm-hmm.
face coverings, the washing of the hands, and continuing to sanitize uh, used areas, especially if you live with someone.
Mm-hmm.
Don't use areas by different members of the family. And families, you need to be wearing masks in your house. We can't express that enough. The family members, you're not excluded from this disease simply because you're related. You still have to follow those precautions in house.
Mm-hmm. And we still encourage people, you have to boost your immune system up using the proper nutrients. It's more important now than ever. And now is the time. Get your system really up and tip top during the summer, because there's more and more evidence to say that when the fall comes, we're going to um, see this thing go higher and higher. Even here in New York, where it seems like it's gone away, there's just really no way to stop it. And let's talk about the methods that the governor is trying to do, now that the rates have come down, to basically keep everyone else from the rest of the country from coming. So now I think it's about, out of the rest of the 49 states, I think there are 25 of them which are on restriction that they cannot travel to New York. And the governor has issued this emergency health order. And so what's happening is that anybody traveling to New York is now supposedly required to fill out a Department of Health traveler form, telling where they came from, how long they were there, and where they're staying. And this order is being enforced at the airport. So here's an announcement from the governor. Travel enforcement operation commencing effectively Tuesday, July 14th at airports across the state. And so, as part of the enforcement operation, enforcement teams will be stationed at airports statewide to meet arriving aircrafts at gates and greet disembarking passengers to request a proof of completion of the State Department of Health traveler form, which is being distributed to passengers by airlines prior to and upon boarding or disembarking flights to New York State. And so they're not only requiring all planes that come up here to have the form, but they're also doing pre-flight emails, pre-flight announcements, and in-flight announcements. So if you are traveling to New York, you are going to have to fill out this Department of Health form. And if you're coming from half the states in the country, um, you're expected that when you get here, you're going to have a 14-day quarantine. Um, Now, obviously, this is not as effective to enforce through trains and cars, but it's clear that the governor is stepping up all things he can do to, I guess, build a fence around New York and hope that nobody gets through, which is probably not going to work.
Yeah, I don't see it. I don't see the truth being told on a lot of those applications. And how are they going to challenge it?
Right.
Because
Hmm.
the bottom line is, for some people, COVID is not as scary as it is to other people. And there are people that could not wait to travel when
Hmm.
traveling was suspended. Their bags were already packed that as soon as I can travel, I'm going to see my sister,
Hmm.
brother, or my mother, or my father. I'm going there. And
Hmm.
so they're willing to risk that, and whatever it takes to get in and to get out, they're going to do. So
Hmm.
he's flying into Newark and driving into New York, or just canceling the airfare and just driving backwards and forwards. Um, the stopping of the cars, from what I understand, will be randomly done. I don't know how that's going to work. I could see all the people that really need to see this to fill out the form, are the ones that sneak through, that manage to get through, that's not stopped.
Hmm.
It only takes one person, just
Hmm.
one person to create your own community spread. So I don't know how that's going to work. I just say it was like a dollar short and a day late.
Yeah. Yeah. Now I also want to talk about, we talked about it a little bit last week. I want to bring this back again. There is this multi-system inflammatory syndrome in children that we still know very so little about it. And this is one of the problems in rushing back to school, is that, you know, how can they reassure people about the risks when you have a whole separate disease besides COVID-19 that is obviously related, um, and they don't know much about it? What we know, and you can see what's on the screen. Um, Children with this have a fever and inflammation in the body that's confirmed by lab tests, and it shares the symptoms of something called Kawasaki disease, but it's not exactly the same thing. The symptoms include a fever lasting more than 3 days, abdominal pain, diarrhea or vomiting, neck pain, rash or changes in skin color, bloodshot eyes, extra tiredness, trouble breathing, pain or pressure in the chest that doesn't go away, becoming confused, unable to wake up or stay awake, and bluish lips or face. And we know that it can be fatal. We've already had some fatalities to this, and so it's important that parents understand these syndromes so that if they see them, they can respond to that right away. As far as diagnosis, they say they can use blood tests, check X-ray, heart ultrasound, and abdominal ultrasound. Um, but then when it comes down to prevention, they're not really telling us anything. Wash hands, keep 6 foot distance, wear masks, and clean high touch surfaces. So they're not offering anything more in the way of protecting against this than they're saying for COVID. Um, I find it interesting because once again, they're not talking about um, nutrition as a way to fight this, since this disease is about inflammation, and we know that vitamin C helps fight inflammation in the body. You would think that once again, here's an opportunity for health officials to share information on how we can use proper nutrients to boost our immune system, but that's not happening here either. So, yo, you're on your own. I empathize with all the parents who are trying to make decisions on how they are going to deal with this issue. We're going to stay on this straight through to the beginning of the school year and try to bring you as much information as possible. This is what we know right now.
I say follow your heart. These are your children. No one can tell you what you should do with your children. They should not be collateral damage.
Mm-hmm.
No, that's just the bottom line. No matter what. Generally, if it doesn't feel right, it's not right.
Mm-hmm.
I think that those concerns of the parents should be addressed. Everybody, I mean, yes, of course, you have to address the staff, the school staffing, the teachers, the educators, the paras. You have to sit down with them or virtually talk to them and find out how they feel.
Mm-hmm.
Parents are being left out. Ask me how I feel about my child, my grandchild, my niece or my nephew that I am I'm taking care of.
Mm-hmm.
Those are the ones that you need to be talking to. You're talking to the wrong people.
Mm-hmm.
If those kids don't go to school, the teachers, the parents, and all of them won't have a job to do.
Mm-hmm.
So I think that's the problem where people have been left out of this. It's the people that can tell you what's happening in their communities. It's the people that can tell you who's doing what. It's the people that can tell you how they feel about the situation with the schools. And those are the ones that's always locked out. You can't sit in governmental offices and decide things for the people without knowing how the people feel. If the parents boycott, what are they going to do? If the parents simply say, my child's not going to school, it's just that simple. What are they going to do? They're going to round up people or send out some more forms to fill out. Is your child in school? Bring them to school on Monday. And if they say no, what are you going to do?
Mm-hmm.
So I say, parents, this decision is up to you. The governor and the mayor, they can squabble back and forth all they want. But I would say pay attention.
Mm-hmm.
Just Google different states where this infection rate is extremely high.
Mm-hmm.
Different states where you see that it was very, very low and now it's surging out of control.
Mm-hmm.
And especially look at those states with those high infection rates amongst children.
Mm-hmm. So, Mayor de Blasio did say that parents will have the option of online only instruction for their children. We definitely want to look into that further. We are going to look more in depth at what were the successes and failures of the remote learning for the spring term, and how is the city set to do a better job in the fall. So I think this is something we are going to work on as an ongoing coverage to just make sure that you understand those options. We're going to look into how many students were left without devices to be able to use, tablets or laptops, and whether there are still resources available that if your child did not get it, can they get it? So stay tuned. We're always here every Wednesday morning at 9:30 with this report on both YouTube and Facebook. And so thank you for joining us. If you're watching this in the archives, you can send information. If you have questions or comments to Harlem Emergency Network at gmail.com, or leave a message at 347-916-619. Thanks for those who joined us. Shout out to Mark McPhee and Soraya, our HEN members, for continuing to be out there and sharing information. And I think we're done for this morning. Join us again next week, and we will continue to follow this story.
Thanks for joining. Everyone continue to be well.